Welcome to the Mind Vine podcast, where we challenge the stigma associated with mental illness through conversations about a variety of issues impacting mental health. Here we bring you news, views, and interviews that intrigue, educate, and celebrate recovery. Leading us on this journey are the hosts of the Mind Vine podcast, Darryl Mathers and Chris Bovey.
So welcome to the Mind Vine podcast. My name is Darryl Mathers, and I'm clearly without my co-host, Chris Bovey, because we are in the midst of COVID-19, a pandemic that's obviously hit the world, and especially, we feel it here in Ontario, and specifically on Ontario shores in Whitby, Ontario. This is how we're doing the podcast now. Like so many other people in the world, we're at Ontario shores while we're still providing care and delivering essential service. Those of us who have been able to work remotely are, and those who have to go in and continue caring for our patients. We think about them a lot. In acute care and traditional hospitals, nurses and frontline staff are getting a lot of attention, and rightfully so, for the work they're doing to help prevent the spread of COVID-19 and obviously curb the amount of illnesses and the death rate in Ontario, and where we salute them. But it's I know working in mental health care, can't forget about our staff who are caring for our patients who are among the most marginalized and stigmatized populations in the world, and their contributions and their willingness to come to work every day and still provide the best possible care is worth recognizing. So before we kind of start into kind of the COVID-19 edition of the Mind Vine podcast, just a shout out to everybody on Ontario shores who continues to work tirelessly to protect our patients. So given the kind of the state of the world today, we're using technology to continue igniting conversations as it relates to healthcare and mental health and a lot of the topics that we touch on frequently. So today we have two guests that are via satellite. If this was 1985, that's what we'd say it. But working remotely, Christina Fuda, our mental health first aid coordinator. Hi, Christina.
Hi.
And
thanks for having me.
We also have on location at Ontario shores, Anson Kendall is an infection control practitioner, I believe is somewhat
correct.
Accurate. So thank you, Anson.
Yeah, that's correct.
I know you're working on site every day, and this is probably one of the biggest challenges of your career.
Yep. Thank you for having me, Darryl. Glad to be here.
So we're going to start. I'm going to start with Anson and the kind of the COVID-19, the pandemic situation that we're in, and then we'll get to Christina about the kind of the mental health aspect and the impact that it's having not only on us, but on people who are now suddenly working from home, caring for children, managing anxiety of living in this world. But Anson, to start it off, we're talking about COVID-19, and we're all kind of familiar with it to some degree. But you were telling me the other day, coronaviruses have always been around, but this one in particular is a little unique. And I was wondering if you could just start by giving a little bit of background on it.
Yeah, thanks, Darryl. So coronavirus and human coronavirus is viruses that cause the common cold. So with all of us having a common cold at some point in our life, we've all had a coronavirus. The new and novel coronavirus, which you're seeing of COVID-19, is new to the world. Why it's causing a lot of disease. We don't have a vaccine for it. There's no treatment for it. And as this pandemic is sweeping the world, we're still learning and trying to catch up on the virus. So that's kind of where we are now. It's new and novel. As more time does progress, we will learn more and how to treat and how to fight this disease. But as of now, we're still learning, and hopefully we get a handle on things.
In terms of its impact on our organization, We have 346 inpatients, hundreds and thousands of outpatient visits. How does something like this change the way that we do business as a mental health hospital?
Mhm. That's a really good question, Darryl. In general, infection and control and mental health, you can see that there's some challenges. When we put infection control measures in place in the mental health population, we do so with, usually using an acute care type model, as you could understand and appreciate. Some of our patients don't understand, what good hand hygiene is and why they should wash their hands, how they should complete antibiotics, for example, why they should have, adhere to good hygiene practices. So you can see that a virus like this that's new and novel, and what we're trying to contain it, is very challenging in the mental health population, both inpatient and outpatient areas. So we struggle regularly, pre-COVID, to contain viruses, community-based viruses. But you can see that this is now another element of another challenge to Ontario shores. Also, a lot of patients do share personal items. They're not supposed to share cigarettes, but they do, and you can see that being a vector of transmission as well. So, in the mental health population, very, very challenging to put infection control measures. We do the best that we can, and I think to date we've done a really good job of putting in measures that are trying to contain this virus.
Now, I know that you've been familiar with COVID-19, although it's had a couple different names. When you first became aware of it, it's been months, kind of anticipating its arrival in Canada. And it seems like as a citizen of the world, watching the news and information come out about it and what we should do and how we should protect ourselves and others, that I wouldn't say information is changing, but there seems to be different interpretations of it as we get further along in the pandemic. From your perspective, like how big of a learning curve has it been to understand COVID-19 and to be able to be educated enough to get a handle on what we need to do as an organization and even in our community?
So you made a really good point that information is coming really fast and furious. And like I had mentioned earlier in a conversation, we are under an infodemic where some information is right and some information is incorrect. The problem that we're facing is there's a lot of regulatory bodies. So there's Region Public Health. There's also Public Health Ontario. There's the Public Health Agency of Canada. There's the CDC out of the United States. And there's also the WHO, the World Health Organization. So as this disease is rapidly evolving, we are actually consulting all those sources and trying to make the best kind of guess with all the information that we have. And obviously there's other regulatory legislation stuff that doesn't apply in Canada. Different organizations are saying different things. CDC, which is a very well-respected organization, has rules that are effective in the United States, but not necessarily in Canada. So to get a grasp of all this information has been challenging. And we kind of take that information and then we tailor it to a mental health facility. The problem is the long-term care facilities and acute care, the guidelines are really black and white in those areas. In mental health, not so much. So you can see that, as a sector, we're kind of taking some elements of the acute care guidance and some elements of the long-term care guidance, and then combining it to make it work for our organization. With that being said, we have to read a lot and get up to speed as fast as possible so that we can make the best informed decision based on the guidance that we have.
Now, just sliding it over to Christina for a bit. We know a lot about coronavirus. We're learning more every day. Our lives are changing every day. It seems like when the schools closed in Ontario, that was a big moment, and we're like, what is going on? And then every day, it seems like a little bit more of what our so-called normal life was is slowly disappearing. Like today, they've announced the closure of construction sites. There's all sorts of stuff going on in the U.S. border and even the Quebec border. It's fascinating from that perspective. But from a mental health perspective, Christina, this is big. This is a big change. It's a big change for anybody is considered to be a I guess the word I'm looking for is able to manage their wellness successfully. But anybody who's struggling, they're even more at risk, I would think, is dealing with something like this.
Yeah, for sure. Thanks, Darryl. It's a really great point because really mental illness, we know, can affect us all. We're all human. Is really when you think what is mental illness is brain illness. It's basically when our brain becomes dysfunctional, and too many changes in our life can dysfunction our regular brain function. It doesn't know how to process so many major changes at the same time. And so this can happen to the best of us. This can happen to any of us in situations that aren't collectively what's happening to all of us right now. Is we can all go through a major life change, like a divorce or a loss of a job or having a sick family member. And that can trigger a lot of the symptoms of depression and anxiety. But right now, what we're seeing this happen collectively to everyone. Everyone is going through things like loss of a job, is having relationship issues because they're stuck with their partner all day. They're stuck with their family, and people are experiencing loss of loved ones. And so we're going to see, unfortunately, a lot more people struggling with mental illnesses like mild anxiety, depression, and unfortunately, when these are left untreated, they can get worse, just like any physical illness. So you're right. I think we're going to see a big toll on this in the upcoming months.
A big part of your job is getting groups of people together, which is problematic in today's world. So you've had to kind of adjust and, in a matter of a couple of weeks, try to reinvent yourself from a professional standpoint and looking at, what the next couple of months look like, and even beyond that, when the world hopefully returns to normal. And even people that may not be in a situation where they've lost a job may have lost a meaningful part of their job. Maybe, a big aspect of their life is being able to go to work. It's their identity. I think of teachers specifically right now, they're no longer teaching. They're still getting paid, but they're a big part of their identity as a teacher. You meet them at a dinner party, it'll be 10 seconds before it comes out that they're a teacher. Same with firefighters and other professions. So when you've lost something like a bit of your identity, how difficult, or I don't know how difficult it is, but how important is it to understand that and be cognizant of it from your own wellness perspective?
That's a great question. And being a teacher in many ways myself, I can identify with this on a personal note too, because when I first heard about, how big this was, all of my courses for the next 2 months were canceled. And so I was like, oh my God, what am I going to do? That's what I do. And so I can definitely respect it. It's a huge loss in your identity, and it creates a little bit of confusion, for sure. And so there's a lot of folks out there that, in similar positions where they're not aware of what to do right now. And so I think it's one of those things that we just really have to identify with other areas of our life is, that's not all we are. You're not just a teacher. You're not just a parent. You're not just a construction worker. You're so many other things. And I think one of the best things that we can do right now is try to re-identify ourselves. And so, Darryl, I was thankful when you gave me this opportunity to re-identify myself in a different way. I've been a teacher in front of a classroom, and this has been great where I can really start to become a teacher in an online forum. And so it's just taken a little bit of effort to re-identify myself. And I think everyone out there is going to be struggling with it, but if you can't re-identify your current position with using the tools that we have now, like online, is, re-identify yourself in a different way.
Christina, I think you make a really good point. On the flip side now, for the infection control practitioners, when we go home, we try to eliminate everything COVID, and we don't want to get involved in any COVID conversations, because for 12 hours of the day, and it has been 12-hour days, this is all that we see. So how do we go back and reconnect with our families and loved ones? An interesting point too. My wife's a teacher and we have a little one at home, and I have to be cognizant of the fact that I am their break in her day as well. So when I come home, for them just as much as they are a relief for me. So we try not to talk about for teaching, and I try not to talk about anything infection control related. Now with a little toddler, everything's infection control related, as you can imagine. But we try to use this as an opportunity to have other conversations, both about on her side being a teacher and then myself being in infection control.
Thanks, Anson. That's a really great point that you're making. And that's why I was saying, I think it's a really good time right now for people to identify with other areas in their life, is things that aren't just their profession. Because you're right, Darryl, is to your first point, is we often identify a huge part of who we are as our occupation. Is, one of the first questions people ask is, so what do you do? In 10 seconds of dinner conversation. So I think for those of us now, like yourself, Anson, where you're spending 12 hours a day, and the last thing you want to do is identify with your occupation, is, you just want to be a dad and, a husband, and finding other parts of our identity, because we're more than our occupations. There's so much more to us. And I think now is a good opportunity for people to identify with other areas of their life that maybe they didn't get the opportunity to before because we're so busy. So that was a good point. Thanks, Anson.
My next question is kind of like, it's two parts, but it's for both of you. The pandemic, COVID-19, the situation we're in, it's changed the game for everybody. And there's a big focus on healthcare workers right now, rightfully so. And I just wonder, in the grand scheme of things, or I guess in the day-to-day operation of things, Anson, like, how has this changed? How our nurses or our people who are on the front lines do their job, like the precautions they have to take? I know we see pictures of PPE and ear loop masks and different things like that, but just the attention to detail that they require at this time. And then, Christina, from your perspective, how do you, when you're in that intense environment as a healthcare worker, how do you leave your shift and make sure that you're healthy? You're caring for yourself at the end of the day. So I'll start with you, Anson.
So how it has changed our environment is there is heightened awareness, and on the flip side, there's some heightened anxiety as well. The good thing is staff members have a great job of paying attention to detail, like you said. So in terms of doing syndromic surveillance in the morning and in the afternoon, in terms of being really in tune with their patients and patients' symptoms, it has helped us identify not only COVID potential patients, but also other diseases. As you know, we're in respiratory illness season, so influenza is also circulating, RSV is circulating, metapneumovirus is circulating. So all of these, I guess, like you said, attention to detail has helped us manage patients within the hospital.
Sorry, Darryl, I think you're muted.
There's a reason I'm muted, because I have 3 children while I'm trying to do this podcast. But what I was just trying to say is that the other part to that, Christina, is our staff are working tirelessly. What are some of the things they should consider after they've had a super intense day at work under trying circumstances?
That's a great question. Is definitely, I was actually talking to one of the OTN nurses. I had to run into the hospital yesterday, and it just sounds like they are just so overloaded and burnt out. So I can't imagine the burnout that many healthcare professionals are feeling right now. So I think it's one of those things where, it's easier said than done. But like Anson already gave a good point, when he gets home, doesn't want to talk about work stuff, is just settle down, have that quality time with family. Is also maintaining good self-care is making sure to still take care of ourselves, where we're still giving ourselves enough sleep, where we're still eating healthy, where we're still exercising. It can be hard in really busy times to stop doing those things, but it's so important that we still, take that half an hour to exercise, make sure that we do give ourselves that sleep. Is even though you really, really want that junk food, try to stick with the healthy choices, because it's going to make you feel better in the end, and it's going to help you for that 12-hour shift the next day. So really, really, stay on point with that. And one of the things I was taught with self-care is just think of how am I going to feel after this? I don't want to do it right now, but how am I going to feel after that 30 minutes exercise? How am I going to feel after that bag of chips? How am I going to feel after I eat a salad? So kind of asking yourself that. Is it going to help me on my 12-hour shift tomorrow?
Anson, did you have some? Yeah, go ahead, Anson.
Yeah, I agree. I think self-care is really big right now. And we have been, of that mindset as well. What we've been doing is we have been telling ourselves, and we've been telling our colleagues, that this is a marathon. It's not a sprint, right? Based on what the data is showing us, based on what we know is coming out of China from late December, based on what the world is going through, we're going to be in this for a while. So self-care is important, and both for the healthcare worker and for in our individual lives. Still, like you said, still work out. The workout is going to be a modified workout, but it will be a workout nonetheless. Right. The fact that, all these junk food places have limited hours may help us out as well. But stretching is a really good thing. Music for us has been really good in our office, whereby, we get some time to get some work done. We put some music on that will make us feel good, and doing things that we find make us feel good will help kind of battle some of those long hours and some of the feelings that we may feel at times that might of depression, anxiety, etc. So that's kind of some of the things that we've been doing as a department to help us cope. Also, laughter is the best medicine. We tell jokes and we try to really lift up their spirits. I do blame some of the media that's going on, because they're showing Outbreak and Contagion and some of these shows on TV, and that's not helping anyone's anxiety. And I do think the media has a role to play to help people help cope. So that's my 2 cents.
I wonder too, just you mentioned the media, I find personally, I keep watching it. I keep watching the news, even though really nothing changes. Right. I keep waiting for updates. I guess that's because I want my life back, like everybody else. And, you're hoping that there's some, magic breaking news that's going to say that, this is over. But Christina, I guess it's for you, but even, Anson, if you have an opinion on it, how should we manage, our consumption of news at this time when there's really nothing else on, right? We're, the joke, the people that we connect with is, it's Netflix. What's on Netflix? Because, there's nothing on regular traditional TV anymore. So, should we be monitoring or be cautious of how much media we're consuming during this?
Oh, for sure, Darryl. Any sort of obsessive behavior of any kind is not mentally healthy for us. So it doesn't matter what you do, everything should really be in moderation. Is pretty much any diagnosis in the DSM will state some sort of level of obsession and where these behaviors have gotten to a point where they're unhealthy. So is something we really should be trying to do is pick a certain time of day when you're going to read the news. If that's in the morning or that's in the evening or that's at your lunch break, give yourself that however long you need, an hour a day, just to look at the updates, see what's going on, and then not obsess over it. If we do it all day long, it's definitely going to lead to obsessions. And you're right, is we want to see when does our life go back to normal. I think we've all pretty much recognized that it's not going back to normal anytime soon. We're going to have to figure out a way to adjust for the next couple months at least. So obsessing over it at this point is not going to be healthy, and it'll detract from all those self-care things that we got to do, like exercise, still make sure you're getting some fresh air, playing with the kids, cooking healthy meals, is, still doing all that good stuff for us. So for sure, I think we definitely need to pick a time when you're going to look at the news and then move on with your day.
Sorry for that slow transition. I'm still learning how to manage all this on my own. So thank you both for making time. I think that this is kind of our first, our first crack at doing this remotely, and hopefully it'll be something when our world gets back to normal that we incorporate as well. I really appreciate you taking the time to talk about this and educating people. And we've, given how long our road appears to be in this, we might have you on again. So thank you very much for making time with us today.
Sure. Thanks, Darryl. Thanks for having me on.
Thanks, Darryl. I appreciate it. I really appreciate it a lot. And I'm glad to do this again anytime.
Thanks, guys.
Thanks.
Begins